I'm almost 2 weeks post-op right now. I got my top surgery 12 days ago in Florida with Dr. Garramone, and I just wanted to talk a bit about how that all went and show you guys how it's healing up. So I got down there on a Tuesday, the day before my pre-op, which was good because my flight was delayed, and if we had gone down the day of my pre-op, I probably would have missed it. And I stayed at this place down in Florida. If you schedule surgery with Dr. Garramone, you'll get an email about this place. It's sort of like a hotel, except there are only 6 or 7 rooms, and it's only for patients of Dr. Garramone. And that was really cool because they knew how everything worked, and so whenever I had any questions, the people running it could answer those questions, and it was cool to meet some of the other guys getting surgery. It was a little overwhelming for me, especially at the beginning, just because the people there were really, really friendly, which is great, but I am not too great with being in groups of new people who talk to me a lot. It just overwhelms me, and so it was a little hard for me to get enough space, and so I spent a lot of time alone in my room because it was a little too much for me. But that's just because I'm weird about those sorts of things. But all in all, it was really great to stay there. And yeah, surgery went really well. I recovered pretty quickly, and it was a pretty easy recovery. I didn't end up using any of the painkillers they gave me. They gave me a prescription for Vicodin, and I never used any of it. And it really didn't hurt much after surgery. And all of the things that they told me might happen, none of them happened. Like, I don't know. I just felt really good pretty much right off the bat. So that was really cool. Um, I'm actually feeling a bit more pain now than I was when I was first recovering before the unveiling. It's still not much, but it's just every now and then my nipples, like where they're healing, start to hurt for like 10 or 15 minutes at a time. I don't know, it's kind of funky, but that's not bad either. So, yeah, recovery was pretty easy for me. It was a lot easier for me than a lot of the other guys who were staying there. I think just because I'm a pretty healthy person to begin with, it made it easier for me to recover, and I have a pretty high pain tolerance, so the stuff just didn't bother me that much. Actually, when I woke up from surgery, I and I was in the hospital and I first woke up, I was asking them like, okay, can my parents come in now? Can I get going? And they're like, no, no, you have to stay here for another few hours. And I was supposed to be sleeping still, and they were trying to get me to go back to sleep. And apparently, I just like wouldn't go to sleep because I just wanted to get up and go. And so they had to load me up with a bunch of drugs to make me sleep because I wouldn't shut up. So yeah, it was. I recovered pretty quickly. Yeah, so I guess I'll show you my chest now. I still can't lift my arms very high, and I can't really lift anything that's heavy at all. And I have to sleep on my back for the next few weeks, which is kind of hard for me because I usually sleep on my stomach. But um, yeah, so this is what it looks like right now. I have to wear these band-aids with this. They give you this like yellow patch stuff that you put over the nipples as they're healing up. So I have to do that every day. And this band-aid and this band-aid are covering where the drain holes are, and tomorrow is the last day I have to do that because then they should be all healed up. And then this is just over the incisions. It's starting to peel off, like right over here. It was going all the way up to there and all the way up to there. And the stuff that doesn't come off by Wednesday, I can just take the rest of it off at that point. So yeah, things came out really great. I'm really happy with it. The one thing right now that bothers me is, I don't know if you can see, but right here in this area, there's quite a bit of swelling, and that's normal, and it should go away in a few weeks or a couple months or something. But it just really bothers me, this part right here. And I mean, I think it's better in terms of my being able to deal with it that it's like in this random place over here and not like over here or here. Um, but I just have to kind of, I get kind of dysphoric about it, and I have to kind of talk myself down from that a lot. But all in all, I'm super happy about everything, and yeah, it's just so cool to the feeling of wearing my shirts with nothing underneath them and walking around without a shirt and being able to breathe and all of that. So yeah, I'm really happy, and I think it came out really great. And yeah, I guess I'll take the band-aids off and show you guys what my nipples look like. They're kind of funky looking right now. They're like, so it's still healing up. I don't know how well you can see, but it's the sutures are still kind of popping out from there. And yeah, they're kind of changing colors a little bit. Like normal colors and everything. It's just like various shades of red and pink, but yeah, some parts are like really dark red and others look almost like my skin color. And I'm really looking forward to them being completely healed just because I have these really irrational fears about them that like something's going to go terribly wrong, which I'm sure it won't, but yeah, I just really want them to be healed up. And yeah, my incisions should be mostly healed in the next few days, and then the nipples should heal up over the next like 3 or so weeks. But yeah, everything looks really good so far. So I'm super happy. And um, if you sent in a submission for my binder giveaway video, I'm going through all of those right now. I got kind of backed up on them because there were a lot. So I'm gonna try and get that all sorted out over the next couple days and get those sent out. And I got a lot of submissions, so I can't give one to everyone, and so I'm really sorry if I'm not able to give you one. I'm mostly going based on kind of a first come first serve basis of who wanted which binder. So yeah, I'm really sorry that I can't help all of you out, but to those of you who don't get one, I hope you're able to um, get one at some point soon through some other venue. So yeah, I think that's it.